Hey guys, I'm Sebastian, and this video is on how to really take a deep look into what's going on with your lower back. Now, the lower back is something that everyone tries to stretch and exercise and build strength in and so on. I will show you at the end of the video, so stay tuned, a couple exercises that I like or stretches that I like, but it's really all dependent upon the information that you gather. I'm a strong believer that the solution to a problem only presents itself after you have the information. And that's the value of having someone guide you and provide you a roadmap and assess your situation. That's what we do all the time at the office here. So make sure that you are getting evaluated for your low back, and that the person should take more than 15 minutes with you, and they should probably touch you too, just as general rules. Now, what I'm going to show you here is just a couple movements, and these are just basic generalities because everybody is a little different, and obviously you can have something serious going on with your low back, but it doesn't have to be. Now, the first thing is if this is your first experience with low back pain, a lot of times bending forward is not helpful. And so when we take people through an assessment process, we just ask them simply, go as far down as you feel comfortable and just tell us how you feel. And some people will get down to here and they say progressively like, yeah, it's getting worse as I go down. And so we kind of say like, look, you don't have to go all the way down, but notice if it's progressively getting worse as you go down, then maybe bending forward is not helpful to you right now. And we kind of say just generally like, what does your spine like? What makes your spine smile? I know it sounds dumb, but really, what is your spine like? Because if your spine doesn't like this, don't force feed it for a little bit. And one of the easy solutions, at least, is doing the opposite. Now, in contrast, some people don't like backwards bend. Now, some people do like backwards bend. And so the very classic case that we see a lot of, which are really easy, simple cases to address, which don't require surgery, don't require injections or medications, oral medications of any type, is the ones that don't like this, but the ones that absolutely love this. Like bending backwards is 0 out of 10 or a 1, when this might be like a 6 or a 7. This one's extremely comfortable. That's an easy win. And a lot of times we can find a quick relief for this person within just a week, 2 weeks a lot of times. I don't want to say to get too specific, but generally a couple weeks is a good time frame for a first aid, we call it. Now, some people don't like extension. They say, yeah, ow, that's worse. Bend forward and they're like, perfect, 0, perfect. A lot of times we find this in older populations, they're considered stenotic. And so stenotic means just there's whole narrowing from arthritic findings, which doesn't always relate to back pain, but it can be. Bending backwards is painful to usually, again, those people, or sometimes young athletes with rotational sports that have something like pars defects or things that are we call the posterior aspect of the spine, the back side of the spine, which is more the bony components. If that is so, then and if you're a young athlete, usually you got to get an image to confirm that there's nothing else going on, because if there was a fracture, it dramatically change the situation. Now, do you need an MRI to assess all of these? No. And by the way, it's important to note that MRIs are a gold standard for soft tissue-based assessment, such as lumbar spine disc and so on, but they're really not, they're not the best for assessment of, say, a fracture. A CT is a better option for a fracture, but a lot of people start with x-rays. You can't see soft tissue on x-rays, so what do? The first thing I like to have people do is just figure out if they can find a position of comfort. If you can find a position of comfort, then it's not the worst case scenario, like you have something like cancer or things like that, mostly, or generically speaking. Again, you want to see your doctor for this, but and if there's a 0 out of 10 at some point, say bending forward produces 7 out of 10, but bending backwards is a 0, it also means that there's not a large inflammatory component, because inflammation is kind of like you got burnt. Like if you got burnt, there's a 5-day process where it just hurts. And I remember I cut my finger here. It was like 5 days straight of just absolute throbbing. Doesn't matter what position I was in, what I did, it was painful the entire time. That's an example of a inflammatory process. It doesn't change much. So those are the ones that are a little bit more challenging. But if there's positions of comfort, it's a lot easier. Now I'm going to show you, I know I've talked a lot and no one likes people to talk on YouTube, you know what I mean? Like they just want to show stuff, so I'll get right back into it. So if bending forward is not helpful, then we'll usually do something like a prone prop, or just laying on our belly. Okay, and a lot of times, again, this takes gravity out of the situation. It makes it so the back can settle and kind of do its thing on its own. Apologize, I have no cameraman today, but they can just generally let the spine settle itself. Again, what makes your spine smile? Well, if I had back pain bending forward, this would certainly make my spine smile, and I'd probably do it a lot throughout the day because I want to feel comfortable. The cool thing about pain, which nobody likes to have pain, and I know it might sound dumb to say this, but pain can be your friend, and it can be your friend if you pay attention to what it's saying to you. It's your body's alarm system. So listen to it, and if this makes you feel good, you do a lot of it. That's what we advise our patients. And when they do a lot of it, all of a sudden, the Latvian cell opens up and they start feeling better within a week or so. But if they were continually trying to stretch it, say we're doing stuff like this, trying to stretch out the spasm when bending forward is actually bad for them at this point, the body doesn't like it, then this is actually going to cause a positive feedback loop will actually make things worse. They're continually triggering their problem. Now, in contrast, if bending backwards was painful, and I've had a few people like this, they're not as prevalent. Bending backwards, the further they bend backwards, standing or laying on their belly, it makes it worse. Then we just do the opposite, similar to what I just mentioned about bending forward. And we do something called a sloppy child's pose. And a lot of people in this position, they're like, wow, that feels pretty good, but not perfect. And so I say, find a position that's more comfortable. And they kind of wiggle around. They say, yeah, that's better, or that's better, or that's better, or that's better. So you can make as many modifications as you want with this. Just find a position that's comfortable. Again, it sounds very simple because it is pretty simple. Like, reduction of pain is pretty simple if you listen to what your body's telling you in most cases. Don't do what's painful, do what feels good, and then build supports for the area. And generally, the things that make you feel good, such as doing those things, we call it a first aid period, a 5 to 10 day cycle, where you just let the body heal itself. It's like a cut. It's just trying to heal itself. Give it a chance. It will slowly get better, and it'll start to wean its way off. But it doesn't really address the whole point of people feeling like they're fragile, okay? And so going into other exercises, such as ones that build supports for the spine of the back, are actually the best in that scenario. And people should, every time, I'm going to say, this is one of the few things I ever say all the time with, is if you have a back problem, you should see somebody. I've had back problems twice in my life. I've had one at 15, one at 35. I don't suggest anybody go through it on their own. And I know it's really easy to think that you can manage things on your own. I've tried to do my own taxes before. It's gone well 3 times and it went poorly once. And ever since I have a professional help me, it's much more helpful because she provides a roadmap. So I do suggest that you guys reach out to us. We're very good at what we do. We're in Huntington Beach, California. And by the way, you can watch the other video coming up, subscribe to the channel. Another video is going to come up pretty soon where we're going to do some of the exercises, some easy win exercises to help support the spine. But recovery is just, it's like a 4 or 5 step process. So reduction of pain is just number one. Reach out to us and email us, info@p2sportscare.com. Again, we will answer questions on YouTube and Instagram and stuff like that, but if you think about it, like, it's kind of like having a yelling match between like a crowd of people. Let's just take the conversation private. I think you'll get more out of it. We'll be able to say more things versus just not wanting to offend other people or whatever on that platform. So just reach out to us independently. I think you'll get the best information that way. So info@p2sportscare.com or call us 714-502-4243. Again, 714-502-4243. We'll do our best to help you out. Even if you don't live by us, we can still provide some guidance. So don't make distance a barrier. Please contact us. All you have to do is start the conversation. We'll be right there for you. Talk to you soon. Subscribe, like, and share. Hey guys, I'm Sebastian. Today I'm going to show you 3 exercises I really like to use for low back cases, low back pain, muscle spasms, not necessarily for sciatica, but this is just for standard, more general, like across the low back. especially increase with sitting. And so there was a video I did prior which talked about some of the basic assessment we like to do, because as anything in life, if you're going to provide a solution to a problem, you have to know what the problem is. And so just some basic information that you guys might have not looked at before, and just getting some good information about your low back to talk to your healthcare provider about is a good idea. So please watch that video, just search back and it'll be there. Now this one is kind of on a step 2, like building supports around it. Usually we ask our patients to decrease pain first. Step 1 is reducing pain, because no matter what you throw at it, perfect rehab, great glute exercises, all that stuff, they're helpful, but they will not really stick because pain corrupts movement. And so we want to actually just get rid of the pain first, so it makes it easier to get these things to stick. So what we're going to do here is I'm just going to show you a couple exercises that are simple but helpful, okay? And so just in the light of making things simple for you, I'm not going to make things overly complicated. Things are simple for a reason. And all I'm going to have you do is just lay on the ground. And by the way, this wouldn't work really well for super acute backs, but usually for subacute or chronic, kind of like things that are just kind of hanging around, these are good things for. So I want you to focus on the floor and try to get up off the floor without making your back feel any negative or positive with it. By the way, something important too is that if you go through the last video we did, you'll figure out maybe a little bit of what makes your spine smile and what makes your spine frown. If you know what makes your spine smile, such as arching or going under like that, then you'll have a better idea of actually how to do this. So I like to have people just start flat on the ground, head down and everything, and then just put your hands wherever you want to, not a push-up, anywhere you want to, and just simply push your hips into the air. And then slowly, 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 almost like you're going to lay onto a bed of glass, super slow, and then move the hands. You might wonder, what the heck are push-ups doing for my back? Well, you have to keep your belly stiff a little bit with this. So we want you to stiffen your belly, and as you go slow, a lot of times building tension throughout the belly, what it does is it reduces the amount of ambient movement that your spine does, kind of like moving gingerly. As if your body hurt or your spine hurt, people just naturally move gingerly, and that's the body just trying to protect itself as things start to heal itself up. So these ones are kind of like a push-up matrix, just kind of pushing the hips back if you want to, or you can just, if you're strong enough, you can keep everything flat. But what we don't want to see is this sagging thing, too much, anyways. But again, you pay attention to what your body likes. The next thing, which I'm going to move the mic for, is we're going to do it from our side. Now, how are you going to get up from your side without getting your back to hurt? Well, it's all going to be based upon, can you push the floor hard with some of the points of your body? Okay, don't make it overly complicated, but move slow and gingerly. So I'm going to choose this way, and I'm up. And then we're going to slowly go down, slowly, 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 and again. Okay, notice I'm using my elbow. An elbow is a really easy pry tool. And you can also get to the point where you actually get to your hands and knees again. And then roll back down again, slow, slow, slow. Okay? It's okay to have multiple contact points on the ground. Use a lot of contact points. I usually encourage people to be okay with pausing. So roll, pause, talk to me. Be under control, talk to me. Find as many pause points as you can versus just kind of yanking yourself up off the ground. Okay? On the way back, I'm going to show you the pause points. So this is 1, 2, 3, 4, 5. I probably could have made more. But make as many as you can. Okay? And I would do this on the other side to make sure to balance things out. Because as we're improving the way the spine is supported, we need to work it from the front side, which was the last one we did. we need to work both sides, which was these ones that we did, and we're eventually going to work the back side. So the backside ones, the easiest one to do is a glute exercise. It's one of the simple things you've probably seen throughout YouTube or other exercise areas. They're called glute bridges. Let's see if I can position myself well in the camera. I apologize, my camera person did not come today, so we're doing the best you can for you. So with glute bridges, I think the easiest thing to do is actually to use the heels through the floor. Don't try to get up. Just push your heels really hard, like you're trying to physically push the earth away. The harder you push, you'll just naturally come up. Usually people who are strong enough, who can just kind of manhandle and do whatever they want, like they don't need to think about pushing the earth. But if you're weaker and you're having trouble with this, pushing the earth through the heels actually gets the glutes working pretty good, and it'll start to kind of slowly elevate you up. And that's all we want. We don't need to go super high, but you can if you can. The thing is, you want to do the hardest thing you can do super well that still feels good, but effortful. Effortful is okay. Putting the hands on the ground, palms on the ground, and heels through the floor, and pushing together with all 4 points. Actually, in this case, it'd be elbows and heels, is a really good way to access more range of motion through the hips. The magic's in the hips. You want to make those hips super happy so they can support the spine and also help out with building some spinal stiffness in the back in a good way, not in a muscle spasm way. And so usually going through reps like that. Now, how many do you do of these things? That's a great question. I'm glad you asked. So doing these, usually I have people do if they're in like a subacute case where it's just really not too bad, but it's something that they've been struggling with and want to get over. I tell them to do it at least once in a day, but spend about 10 minutes just going through the different things. If they're really gung-ho and getting over things, I tell them to do multiple times a day, and then usually go for a walk right after they do it. How long is the walk? How long do you want to do it? Anything's better than doing nothing at this point for most of you. So make sure that you just get on the ground every once in a while, embrace the struggle. It shouldn't hurt. Embrace the effort and use parts of your body like your elbow and your heels and your knees to get up. Generally speaking, the more you use those, the more you'll actually get your core to help engage, which is what a lot of the science says is helpful for backs. You also have to get the hips and the shoulders to work too. That is a whole different story. But these are just some basic fundamental exercises you can use, but there's various other ones to use. So if you like this video, please put a thumbs up for me. I put a lot of videos out there, and I really like to see the videos that you guys like so I can know to make more of certain things. So please let me know. And we're in Huntington Beach, California. We'd love to help you out if you live close. If you don't live close, don't fret. Distance is not a barrier on this, so don't make distance a deterrent to contacting us. We do our very best to help people find the solutions that they need wherever they're at. So just email us, info@p2sportscare.com. That's where we help out the most. On social media and YouTube and all that stuff, we will like answer a little bit, but we tend to not go super in depth because it's kind of like a shouting match between a bunch of people. So because other people can comment on that too. So make sure you just have a private conversation with us, and we can do that via video. We can do it on email or on phone. So email info@p2sportscare.com. That is the best way to go. If you want to call us, you can, but we're a little slow to get to the phone. 714-502-4243. Again, 714-502-4243. Feel free to share this with a friend who's dealing with some back pain and just let them know they will get better. Most people get better. They just don't know the right roadmap to take. So we're here to supply a nice roadmap for you guys. Hope you enjoyed. Talk to you soon.